One of the biggest things that has changed in trauma is our goals. It used to be that we were really just focusing on saving people's lives. And as we've gotten better and better at saving people's lives, now we're really focusing on getting people back to the things that they love. In orthopedic trauma, we take care of fractures, or what people call broken bones, in particular more complex fractures. We take care of pelvic fractures, tibia fractures, especially ones that involve the joint. We also work a lot on the femur, particularly hip fractures. Tibia fractures can be a very complex injury because they affect how patients are able to walk and how much they're able to move, particularly at the knee. So there are ways that you can fix them that make the patient have a better chance of getting back to the activities that they love. Pelvic fractures are a severe life-threatening injury that orthopedic traumatologists specifically take care of. In the past, a lot of patients with pelvic fractures didn't survive, but we've gotten better at taking care of them with the trauma surgeons evaluating the patients and stabilizing them. And then now a lot of patients are not only surviving, but getting back to their life and being able to walk, and sometimes even getting back to things like work and sports. Pelvic fractures are most commonly the result of a severe trauma, typically something like a car accident or a motorcycle accident where there was a lot of energy involved. Patients with severe injuries, particularly to their leg, can be faced with the difficult decision of whether to go forward with surgeries to save their limb or to go forward with an amputation. So that's something that we talk to them about, and the pros and cons to both. If someone has a limb-threatening injury, it typically involves their muscles as well as their bones, and often the blood vessels as well. So it's a very difficult decision and a long rehab. If a patient does decide that they want to go forward with limb salvage or saving their limb, we do everything we possibly can to save that leg, and we have the team here to do that. We have plastic surgeons that can help with coverage. Our team addresses the complex fractures and helps to fix those, and then we have the rehab team to help patients recover and get back to the things that they love. One of the things that makes MedStar unique is the multidisciplinary team that we have here. Particularly for patients with limb-threatening injuries, there's a plastic surgery team that can provide coverage. So when we fix a fracture, we have the ability for it to heal. Once that patient heals from that surgery, the rehab team is really superior in helping them to get back to what they want to do in their life. And we also have an excellent prosthetics department that can help patients to access either braces if they go through limb salvage or prosthetics if they end up going through amputation. What I love most about being an orthopedic trauma surgeon is that we meet patients on what for most people is the worst day of their lives, and then we're able to see them get back to their families and the things that they love. I've had the privilege of patients inviting me to things like their weddings or their college graduations, or just sending me a video of them walking for the first time. And that makes me feel thrilled and proud for them.